Here is the third podcast in our Inside the Summit series. This episode features Michael Nacarato and Donald Mones from MUFG Union Bank and Michael Serghiou from Merck, speaking on the topic of how government regulation is impacting vendor management and related outsourcing services globally.
Good afternoon, everybody. My name is Michael Nacarato. I'm from MUFG Union Bank. I'm the Track 4 chair, so some of you that have been in this room today and have seen me up here every time, I'll be here all day today and all day tomorrow facilitating the events. Also, I am going to contribute to the presentation here. But before we get started, and I don't know if you've heard this in every session so far today, but it's really important. If you can download the app and you can go to eventmobi/OWS16, it's really important that we give all of the presenters feedback on their presentations, as well as your feedback and your verbatims are taken seriously. I don't know if you've noticed, but it's been the fact in this room here. The presentations have really been pulled back to about 8 to 10 slides to really allow for very interactive questions and best practices. And that is a direct result of the feedback that we got last year from the presentations. So it's really important that you give the feedback, and it's definitely listened to. So we'll remind you at the end as well. And also, we're recording the sessions, so I'm going to be working the room and being able to hand the microphone. So if you can wait for your question until you have a microphone, and the presenters are mic'd also. So with that, I'll turn it over to Donald Mones.
So nice to see everyone. So my name is Donald Mones. I am new with Union Bank, MUFG. For those that have known me last year, I was at another company, and I've had a few job changes in the last few years. So I'll go through the slides. The couple things I just want to do before I turn it over to Michael to introduce himself is questions during the session is really important. And as I said, Michael Nacarato would be there with the questions. So it's important to have questions as we go through the process.
Good afternoon, everyone. My name is Michael Serghiou. I'm the Externalization Director at Merck.
And you've met Michael Nacarato before, who will also be participating. So a couple things about the session. So this is really about regulatory impacts on outsourcing. And what I always like to do is just a show of hands. Buyers in the audience? Okay. Advisors? Great. Providers? And I always like to see who are the lawyers in the room.
So one lawyer.
We have one lawyer. Okay, good. So that's always important to know. So, a couple things we want to go through with the facts of what we want to talk about. And I'm always a big fan of what we achieve at the end. So we want to basically talk about understanding, of regulatory expectations. It's really changed a lot, and you'll hear both from the banking side, Michael and myself, as well as what's happening on the pharmaceutical side, how regulatory impacts are really changing the way we own and operate and work with our vendors. And for those that are providers in the room here, if you haven't been involved in helping with regulatory oversight issues, you will. The second piece is decision-making and how vendor management organizations have changed to accommodate a lot of what's happening on the regulatory side. Third is we're going to talk about operating models, and Michael's going to talk a little bit about the Michaels. We'll talk a little bit about the changing environments that we have, and I'll say Michael N, Michael S, just so it helps everybody. And we'll talk about the importance of being able to demonstrate to regulators. And I always so who in the room has had to go and present to the OCC or the FRB? Oh, see, the others won't raise their hand because they're too nervous to do it. We don't have any OCC and FRB people in the room, do we? Anyone? Just so you know, last time I did this, we actually had someone from the OCC in the room. So I tell you, it really changed the dynamics. Oh, I'm sorry. The FRB, Federal Reserve Bank, and the OCC is the Office of the Controller of the Currency. The OCC basically manages it and puts in regulation and guidelines of how banks operate. Mike, you want to add a little bit more flavor to the OCC?
Yeah, I'd say particularly in this case, they have put out guidance back in 2001, 2002, and guiding financial institutions on how to manage third-party risk. And then they had a separate guidance in 2002 on how to manage offshore third-party risk. And they hadn't refreshed that guidance until October of 2013. And they had come out with enhanced guidance, more specific. The first guidance was prescriptive. This one was very descriptive. So they sort of hinted what they wanted us to do, and they like audit, they can walk right up to the line without telling you exactly what to do. But it was stronger suggestions, I would say, in the most recent guidance. And financial institutions have had to react to that and change their third-party risk programs to be in alignment.
Absolutely. And Michael, with Merck, you have different set of regulatory.
Exactly. We have the FDA, obviously, that we have to worry about from obviously, in our industry. So a lot of regulation on that, but also a lot of pressure on the pharmaceutical companies to accelerate a lot of our products, right, and get them in our pipeline. A lot of the products that we have are coming off of patent. So obviously a lot of financial pressures for us to invigorate that pipeline. But on the other hand, we have to worry about the regulatory side of it, right, and make sure that we're not doing anything stupid, right? So we want to make sure that people are safe, with the products that we're developing.
So for those that are involved with a vendor organization or the providers working with a vendor management organization, the question always comes back, how important is regulatory issues? Right? Do I really need to worry about it, or can I ignore it as long as I can, and then when I need to respond, I will? When you look at this, and there's a lot of surveys, and this is public domain stuff, but if you look at this is a Deloitte University Press, but when you look at regulatory compliance concerns and issues, it's number one. And if you think about this compared to, 4 or 5 years ago, do you think it was still number one prior to 2007, 2008 on the financial services side? Probably not. Absolutely not. When I started in the outsourcing business, back in 2000, 2005, there was really no government oversight. We outsourced what we wanted, how we wanted. We did our own contracts. Now it's critical. And number two is cybersecurity. So that's, it's very important because a lot of the outsourcing that we do have impacts to other people having access to our networks, our emails, and so on. So it's amazing when you see this. And again, this was driven towards more the financial services. Michael, on the pharmaceutical side, do you see the same issue?
Oh, absolutely, absolutely. Especially now that we have increased our third-party dependence, right? And a lot of these folks are obviously not operating here in the U.S. In our case, we do a lot of our manufacturing externally. So we have a lot of about 50 or so partners that help us actually produce our products. So although they're doing this work for us, ultimately we're accountable for the results of their operation. So we put a lot of focus around regulatory and around safety and quality.
So for those that know me, I always like to have a cartoon or two. It kind of helps. So just in terms of making sure everyone understands what is regulatory risk and the government oversight, on the left side, so you can't see it, it says, here's the ground rules. Don't tell me what I should have done. And on the right, we only have a few rules around here, but we really enforce them. So, the idea is to be able to look at the different regulatory oversight, see what you have internally, see what you don't have internally, and it's important to kind of look at that. And the definition of regulatory risk is here for you. I'm not going to read the slides to you, but it's important that you understand what the regulatory risks are. And it doesn't have to be financial services or pharmaceuticals. You can have regulatory risk if you're I worked for Viacom for a period of time, and you have also the FCC regulatory issues regarding children's TV and broadcast. So I think many of us are starting to see more and more regulations, and this is only the U.S. There is a ton of regulations that are happening outside the U.S. and other countries regarding outsourcing. Even China has very strong regulatory oversight of outsourcing. I know people say that's pretty ironic, but it's true. So it's happening all over the world. We just talk really about what's going to happen on the U.S. side. Any comments before we move on, Michaels?
So on the regulation side of it, I mean, one thing is obviously around the safety implications. But a lot of times we also, when we outsource, we have a lot of regulation in other countries around work councils, right? So, you have to be very, very careful. The other area that we have to be very, very careful is about co-employment and how that gets translated in other countries around the world. So we do have a large contingent workforce, right, around the globe. So we need to keep our eye on that and make sure that people are reporting back in, who's on our payroll, what companies are we working with, what is their background, where are they getting these folks from. You guys noticed, an increase in also just overall security with everything else that's going on around the world. So we need to make sure that all the right background checks take place and so forth. So there's a lot of different parts of regulation. So a lot of times we think about it just on the products that we make, but there's also other regulations that we need to be aware of.
Yes. Question. Wait, hold on one second. Yeah.
Just another point I want to add, I think, to the point I think both of you raised, is that, yes, there are a lot of other regulations like MAS for Singapore, there's FINMA and BaFin and all of it. I think what we're seeing a lot is that some of the global banks, what they're doing is now setting up a framework around the more stringent ones like the US, the UK, Singapore, et cetera, to try to meet the guidance in terms of the requirements. And to your point, and that keeps changing every year, I think, but being aware of those changes and making sure that you understand what those are and managing the third-party relationships to meet those requirements is really, really important.
Exactly. I mean, we have in our industry, we also have the Sunshine Act, which basically talks about bribes, right, around the globe, right? So when can you have a conversation with a doctor somewhere, and how and if a doctor can promote your product. And again, it varies by country. We're more mature here in the U.S. There's a lot more adoption now in Europe, but now we're actually seeing it also in Asia.
So when you think about the history of how did we get here, and you think about what Michael Nacarato had mentioned before, in 2013 there was a rule, but a lot of this started in 2006, 2007 with financial services companies. And I don't want to assume everyone remembers. Do you know why 2007 was so critical in how this all changed? Do you remember what happens? It's all the subprime, banks being acquired. There was a financial crisis, recession was hitting, and a lot of the blame was put on companies that were doing ratings, right? S&P was people were blaming it. And the government stepped in and started looking at how we operate, and part of that grew into how do we outsource, because that's now a responsibility, that you can outsource work, but you can't outsource the risk. So, Michael Nacarato, so when the guidance came out 2 or 3 years ago, how differently did you start looking at the relationships that existed?
Well, we took a couple different approaches. Obviously, it was new guidance, and we really we couldn't boil the ocean, right? You have hundreds of vendors and third parties, depending on the size of your organization. We really took a top-down approach. We categorized who are our most critical vendors, who are high-risk vendors, moderate, and down the line. And the thing I was going to add on the other slide, but I think it's pertinent here, there's no competitive advantage for one company, especially in financial services, to figure this out. It's the regulator's perception of the industry. So it's in our best interest to be collaborative and figure out how we can get this right, how we can get a core foundational program for managing third-party risk, so that when the regulators go from one institution to the other, they can see the industry changing. Just one of us doing it well doesn't help the others down the line. So when we see this guidance, it was a great opportunity to do a reset because it is enhanced regulatory requirements, and then coming up with a foundational program. A couple of the different presentations this morning were talking about the Center of Excellence. And Michael, you were talking about the Center of Excellence and how I picked this up because Bonnie Bunyanarek here is one of my colleagues. We weren't a mandated group. She was texting me during the session, hey, that sounds like our group. And I said, yeah, it sounds exactly like our group because top-down didn't mandate that they used the Center of Excellence. And it sounded like in your organization it was an opt-in. So this next step now is really top-down executive buy-in, coming in with a single enterprise-wide program. And then a lot of the questions in the audience, how do you govern that? Yep. Well, you have to have the governance to make sure that everybody's applying it the same.
Right. And a lot of that, and we'll come to FDA stuff, is because executives at financial service company have to sign off that they understand the risks. And that's a big change. So in the past, if something got screwed up, who did you hold accountable? The vendor. Yeah. Now when there's failures, who do we hold accountable? The senior executive that sponsored that outsourcing engagement. They should have been aware of the risk. They should have accepted the risk. And it could be the business too. But that's a big change. Being held accountable before 2007 didn't actually exist. And it's crazy. People were thinking about that. But that was a big issue. When you think about the FDA and you think about drug testing, and when I was talking to Michael about what pharmaceutical outsourcing exists, I learned a lot because I didn't realize to the extent that these guys are outsourcing the testing and the manufacturing of drugs.
Yep. Exactly. So what we had to do is we had to bring a renewed focus on this stuff, right? So in the past, it was always battles, let's call it, between the various functions and the internal auditors and compliance teams, right? Nobody wanted to talk to them, right? Because they always thought it's a lot of work, it's a lot of trouble. But now I think we're turning it around where it's more of a collaborative effort. So we put everything under an overall enterprise risk management approach that we built. And everybody now understands what their role is. So now we even do things more proactively, where we actually invite them in and say, look, I'm not 100% sure, right? I don't know. A lot of times we don't know exactly what the right answer is. Why don't you just come and take a look here with the fresh set of eyes and tell us, is there something that we're missing here? Then the other thing that we do is we put, from a procurement perspective, we put a very rigorous process up front when we're introducing new vendors in our environment. So we have a slew of questions and regulations that we have to go through to approve these guys. And it's not just the U.S. government. We have things that are mandated to us even by the UN around child labor, for example. So there's a lot of different things that you need to consider when you put this stuff together. So that's one part of it. And then after, when they win the deal, then we have put together the right governance in place to look for themes, right? Because a lot of times, it's always a surprise, right? I mean, you try to do your best, but there's always something that you're missing somewhere. So that's why we always invite in our audit and compliance folks and say, hey, take a look, right? Did we miss anything? We'd rather have them find it, right, and take a proactive and corrective action rather than have the outside regulators in and then it's going to open up the entire thing. Not that we're doing anything wrong, but it's just.
and when you look at the people ask, what's the importance of these rules with financial services? What's the importance of these rules of the FDA? And at a very high level, you think about people's money, your savings is at risk if a financial services makes bad decisions. What's the risk if a pharmaceutical company screws up? Right. Look at the first line. These products are highly regulated to protect human safety. People die. People get sick. People don't get better as a result of it. So there's always that balancing act between too much regulation and too little regulation. And I think when you think about what the financial services have been implemented with, you think about what they said. It's called a guideline. It's not a rule of law. It's a guideline. And it's very hard for us to interpret a guideline because many, like Michael said, many companies will implement the guidelines differently. And that makes it easier and harder for some companies. But that's important to understand the language there. And in terms of the FDA, I think they're very prescriptive in what you have to do.
Absolutely.
And there's not guidelines. There's
there's some things you just need to adhere to. There's no room for error. And here we have protect human safety. We also have an animal health division as well. So even in that space, there are certain things that we need to do because a lot of the medications and things that farmers have and so forth, we need to make sure that we test them because eventually, you're giving it to a cow, but eventually that cow is going to be consumed by a human, right? So there's a huge chain of reaction of different things that can happen. So although it just says human safety here, it's also, for us at least, right, because we have an animal health division, it extends even in that space too. So it gets very, very complex.
Question? Yes. Okay, 1 second, let's just grab the mic. Hold on 1 second.
An observation, the thing is, however mature the bank is, this is more towards financial services. These guidelines are evolving, and sometimes the aspect of risk which the regulator is able to bring from you through a lens of looking at various banks is completely different from what you would have perceived. For instance, you could have had a relationship for the last 15 years which is working fantastic. There's a new risk now called the concentration risk. If that vendor is the same vendor servicing 15 banks and your critical process with them, no matter how well they are doing it, the regulators are asking you to take a look. Can you bring part of the process in-house or do a multi-vendor sourcing? These are new things which are coming.
Right. Michael, do you want to comment on that?
Yeah, I was going to say that's absolutely correct. There's geographical concentration, right, being in the same geography, and then there's also third-party concentration where you have the majority of that. We talked in the session just before this about the champion challenger model, right? Those of you that were here, Dr. Copenhaver is here, the Xerox and Humana, that partnership and collaboration and having different third parties as part of a total program. And that's how you dilute that concentration risk.
Mm-hmm. And yes, one question in the back. Let me just grab it. Hold on 1 second. Hold. Let's get you a mic. We're going to give Mike Nacarato a Fitbit so we can keep track of how much running around he's doing.
All right, thank you. Now, do the regulators provide any guidance of what processes do you keep onshore versus offshore, or that is a totally commercial decision for the company, whether if it's healthcare or financial services?
So I'll start off, and absolutely they do care When you think about the type of information, the personal privacy, the privacy information, the non-public information. So absolutely, the regulators want to know what kind of information it is. And it's part of the guidelines when you go through the typical assessment, what kind of information it is. What access do they have not only to view the information, but to actually have it on their facilities, right? So a lot of companies set it up where there's a virtual desktop, but they can still see it. So you have to be careful. Can they take a picture of it? Yeah. So absolutely, the regulators are very concerned about the type of data, who has access to the data, also the environment in which the data could be viewed. Is it a secure ODC, offshore development center, or is it a shared area? Very important. If they don't ask you day one, they will ask you on day 10.
Yeah, the only thing I would add to that, it's the how, right? They're not as concerned about the what, because many organizations have captive sites, right, where they have their own facilities and their direct employees. They're really looking at the how they access the data, how it's stored, where it's stored.
So while the mic is going there, and these are, when you think about this in terms of the access, the compliance, these are all the steps that are very prescriptive in terms of what each scenario goes through. So if you look at each of these items, concentration risk is in there, compliance risk is in there, access risk as well.
Yeah, just want to add one more point to answer your question. So it's the question. The guidance is not so much about onshore, offshore, but to the point I think Mike made is it really about what data and what roles, and those regulatory requirements are different for movement of data. Even if you're moving to a shared service center which belongs to a bank in a different country, there's a different set of requirements when it comes to movement of data and movement of roles, and they have to be evaluated by process, sub-process. So there's a whole. So it's really, you got to get to the nitty-gritty of what is required, and that's but because a lot of times I've talked to banks, they think because it's moving to a short service center, I'm like, that's not the case. No. Because even if you move it, and to the point again Mike said, it's about viewing your data, accessing your data, and processing the data. It's completely set of different requirements.
Yeah. And there's also a legal component to it too. So when a breach does happen, right, who's liable? Which laws are you going to leverage? You're going to use the U.S. laws, or you're going to use the local country laws, right? So that also varies as well.
Yes. So how on the OCC side, how do you as a buyer of services deal with the issue, and same thing on the pharmaceutical? You cannot give up your fiduciary responsibility. So in the end, you still hold that. How does that work in terms of your negotiations from a provider's perspective when it comes to these things and the kind of teeth you can or cannot put into the agreement about, are we going to provide procedures in the spirit of the law or to the letter of the law, that kind of thing?
Well, Michael, you want to start, and then I'll. Yeah. Well, so the answer is that it's not perfect, right? It's not because at the end of the day, what are the risks? And the risks are someone could take a snapshot if they get a camera. They could use a USB drive. They could do something to take that information out, and we're liable. So it's never 100%. But the idea is to be able to go through the beginning of the discussion. This is what I want to do with an offshore vendor. These are the controls that I put in place. These are the procedures and processes that I put in place. And you have to be able to do ongoing monitoring and management of that relationship. The days of you sign the contract and you just worry about when you have to renew are gone. It's a matter of you have to be able to monitor and show compliance on a regular basis. You have to show that you're looking at country risk. You have to show that there's concentration risk, and you're aware of it, and you've either accepted the risk of a potential failure, and this is what we would do if it was to occur, or you eliminate it. You say, I'm not going to go outside my company, I'm not going to go outside my country, and I'm going to restrict it very, very prescriptively. So that's what these go through in terms of making sure you understand that risk completely.
And I would say from a holistic risk management perspective, a holistic program, operational risk is usually the umbrella. Outsourcing risk is a component of, and you're using outsourcing as a strategic lever, not an overall strategy. And having those things documented on what you would and would not do. Now, those things can change as your company matures and you have a higher risk tolerance. But like Donald said, when you get examined, they want to see the evidence of how those decisions were made, how you weighed the risk, and under what conditions you accepted the risk. And quite frankly, providers, that could be the death penalty for them if there was a breach and that made the news. try to get more business after that happens. So we know that the suppliers that are in our RFI process, have been solid in this space and haven't had any major breaches.
Right. In my fact, can add to that as well. So within our contracts, we also have a section around audit rights. So how often we can audit them. So that's one way of doing it. Or you can assign an agent, because you can't always be, let's say, in China, always be in India, right? So you can always assign an auditor to do that work for you, right? But I think the other thing that's fundamental is also how do you build a relationship with these suppliers, right? So a lot of folks, what they do is they outsource, and then they never go to India to see what's happening, right? So over time, right, things get lax. But if they know that you're watching, if they know that you're part of the team, if they know that the risk is not just on you, it's also on them as well, I think it's also behavioral, right? You need to start putting the right behaviors together. And a lot of times it could also require them coming here, right, and actually looking at the operations here in the U.S. and how we do business, right? And then they take lessons learned back to these centers, and you have to keep an eye on them. I mean, you can't just.
We'll get to your question. So the other thing I just want to understand, this all costs money and time. That's the real scary component of this the guidance that we see on the financial services side. We have to do it, and many organizations are spending tens, 20, millions of dollars on being compliant with regulatory issues. And we'll get to the question in a second. The one thing that was really interesting, if you look at some of the regulations, they actually question a company's intentions of outsourcing as you don't know you don't know your vendor well enough. Know your customer, know your vendor. If I'm using a TCS or a Wipro, or these companies have 300,000 employees, how could they not be capable of doing this work? But the regulators come to us and say, are you sure they could do this work effectively? Otherwise, you shouldn't really outsource it. So it's very interesting to see that level of detail. So we got a question in the back, then we'll come up front. Yeah. So you were waiting. I'm sorry, turn the back. Okay, go ahead.
Just as it relates to knowing your vendor, are you seeing much relative to fourth-party risk and getting your primary contractors, to agree to provisions in regards to their subs? Again, that's going to add time and money, and also, a lot more work for your prime.
Sure, especially in our external manufacturing space, there's obviously other third parties that are either delivering materials to them and so forth, right? So somebody might have a bad batch somewhere else, right? So again, it's that end-to-end understanding, the entire process end-to-end, understanding who is involved, and it's also asking them and having those strategic meetings with them, right? And having the governance basically, and say, hey, who's serving you guys, right? So let's get that understanding, right? What are you guys doing about it? And sometimes the manufacturers, they may not be as mature in some aspects of it, but it's about creating that consortium where they can learn from you, share best practices, and make sure that at the end of the day, it's good for everyone, right? Everybody stays safe that way.
Well, the contract terms of sub outsourcing is you're responsible. The buyer of the service is responsible. So you can either say you can do it, or if you do it, there's going to be a separate contract. So a lot of companies are actually, if you want to sub outsource to B, I'll have to contract with B. Yeah. And that makes it more time consuming and cumbersome. But that's a big issue. So for the larger companies that are doing a lot of sub outsourcing, I'm always asking, why are you outsourcing to begin with? Why do you need to do that? I'm hiring you to do the capabilities. Yeah. Once you go outside your own company, the risks are even greater. So it creates more issues back to us.
Yep. And one of the schedules that we typically have in our contracts is around approved subcontractors, right? So we need to know ahead of time who, if you are, that's great, okay, but tell us who they are. And if you're going to add or subtract someone out of the list, we need to know about it, right? So there's got to be some sort of change control through that process, so we are at least aware of it.
So customer complaints are coming through multiple channels now, and I know the OCC has some requirements around that. Are there any solutions out there?
For managing complaints?
Well, managing the complaints through the multi-channels and the governance that the OCC is requiring now to be able to track it all together.
Yeah, and that's specifically under the CFPB, the Consumer Financial Protection Bureau. Mm-hmm. We have to have evidence and demonstrate, one, that we're chronicling all the complaints we get through the multi-channels, how we're resolving or remediating those issues, and then more importantly, how we're taking the learnings from those complaints and then getting it back into our quality and our training processes. So that's something that the CFPB really focuses on, especially in call centers and online.
Yeah.
Yeah, if you look at it's a question over here. If you look at the amount of regulators that are involved in the market, right? How many regulators control the U.S. financial system? It's a dozen or so. So we've only talked about two, and Michael's talked about FDA. Yeah. But there are so many organizations that if you do mortgage loans, there's a lot of things you have to worry about. So for those that are involved in different types of programs, you've got to look at all the regulators, and you've got to see what they all have, because you can't say, I didn't know. If you're speeding, you can't say, I didn't know the speed limit. And the same thing with the regulators.
So it begs the question: if you're advising, one of your suppliers, would you tell them to, invest their time in finding stronger methods to comply with the guidelines you provide them, or would you tell them to invest their time in making sure your guidelines are in fact going to be in compliance with the standards set out by the regulatory bodies?
So we'll start with Michael. So I just some of the testing things that are in here that are kind of interesting. But if you want to take that question first, Michael.
So in our contracts, we have the bare minimum that they need to adhere to. There's no debate about that, right? Now, there's other things maybe around quality that we work together with them, right? So obviously we want to make sure that whatever they produce and whatever we put on the shelf and deliver, that it is obviously it's been tested and make sure that it's of the utmost quality. The other thing that we do is, just because a drug has been approved and it's being used by the consumers, we actually have a specific help desk where patients call in for any adverse effects. So we cover ourselves that way as well, because we do our clinical trials. We know what some of the symptoms are, but you're not going to be able to test every single patient out there because everybody's different, right? But we have this other mechanism in place for us to be able to capture some of those customer complaints around things, and then this way we demonstrate that we're proactive on it.
Alex?
How important is a service provider's ability to demonstrate compliance readiness to the selection process? And assuming it is important, can you point to things that providers can do to really stand out in that area?
Well, I'll start, and then I'll turn to Michael Ann. So they have to understand what the regulations are that we're being held to. And for the RFPs, and I haven't been involved with my new company a lot of RFPs, but I always put in my RFPs, these are the regulatory oversight issues that you need to be aware of. If you can't demonstrate as a vendor, as a supplier, that you understand these regulations, then that's a weighted item that hits you. So if you don't understand that there's a risk assessment, if you don't understand that I have to do disaster recovery plans, if you don't understand that I have to look at concentration risk, you're not going to be a partner provider of mine. And that's kind of how you have to look at it.
Yeah, and you also have to invest in this third-party due diligence. I've seen some, when I was a consultant, I've seen some clients where they chose to omit. They didn't want to even go and visit the facility, right? So I think you need to go there. So being on paper is one thing, because they're all going to yes you to death, right? Yeah, I do this. But you want to go to the facility and say, okay, show me your operation, right? Show me what you guys do on a day-to-day basis. Show me your standard operating procedures, right? Show me examples, right, where things went wrong. Show me your risk registry. Show me all these other things. So I think that due diligence and being on site there is a very powerful way for you to actually validate what they're saying to you, right?
And this is just, you'll see copies of it, but these are the lists that we go through that we live with day in and day out. Whether you do financial services or pharmaceuticals, it's still a good practice to understand these and apply them where it's appropriate, whether it's retail or other areas. So you can see those lists later. And so Michael, we're going to pose this question to the audience. I'll let you.
Well, real quickly, I just want to touch on two things. I think the question you were asking is, what do we expect out of our suppliers when it comes to U.S. regulatory changes? Without giving it away, we had the sessions this morning. We had buyers-only sessions, and we had the advisors and suppliers where we wrote down, and we're going to come together on Wednesday and learn what buyers and suppliers wanted. That came up at my table, all three sessions, is looking for suppliers to be out in front of and having dedicated folks in their organizations, almost like we would get the call first. Hey, did you hear this new regulatory requirement? This is what we're doing to get out ahead of it for you. So I think that answers your question. And the other thing about fourth parties, there's a big push for us to even manage our own affiliates as the third parties with arm's length. So knowing what we're calling as a fourth party is critical too. And there's actually a positive advantage to really knowing the fourth parties also, because in financial services, we get ranked by our supplier diversity. And there's tiers that you get credit for in supplier diversity, and a fourth party is also counting. So you really want to know who your third parties are using, because then there's scoring and there's credit for supplier diversity there also.
Right. So the final thought, just to go back to you. So, how many of you have been involved in a outsourcing deal where regulatory issues, things outside of your company, had to influence some of the decisions you made, whether it's regulatory or then geography? You have to outsource to South America. Anyone have an experience they can share? Wow.
Safe harbor is a big one.
Yeah, safe harbor.
Yeah, it's been looming on us across Merck, and we had a lot. Well, when between Europe and US, when we could transfer the data, that was a different scenario. But now it's so difficult because a lot of suppliers are bringing low-cost locations solutions, which is outside of the US, outside of the Europe, and it is a big roadblock.
Yep. Absolutely. We got another question in the back. Oh, go ahead.
I recently joined an organization a few years ago, and what they've done is outsource the visits to India to another company instead of actually doing those visits themselves. The company I came from before that was an absolute no-no. But what's your take on outsourcing the actual due diligence visits?
Well, so outsourcing the responsibility of risk management is it could probably work well, but you just have to accept the risk that you're outsourcing someone to verify that the vendor is doing what you expect them to do. So again, the way I look at it is you have to do risk assessment. You have to go back to that original question. So if you can't physically do it, and it's between not doing it and having somebody do it, absolutely. That's the whole idea of outsourcing. You don't have the capabilities to do it. But at the end of the day, remember who still owns that responsibility. That's the issue. Yeah, I'm sorry, go ahead.
With the volatility in the world, what is the governance around leaving an area if it gets to be too volatile? What is your exit strategies, and are they governing those?
Well, the first thing is you have to have one, right? The first thing is you have to be able to figure out how to get out of a country, get out of a city. I've had a couple in the past where there were problems, whether it was a terrorist attack. If you remember about 10 years ago, a great location for outsourcing was Egypt, right? And a lot of companies ran to Egypt, and many did not have an exit strategy. So that if something was to happen, so you have to be able to, as part of the guidance, is you have to have the ability of understanding what if I had to move it out of India? If there was another power outage in northern India, what happens then? Or what happened in Chennai? Flooding in Chennai. Yep. So I spoke to some companies. They were in the middle of evaluation of putting some major work in Chennai. I've been going to Chennai since 2002. Guess what? It floods every year. Mm-hmm. This was horrible flooding, but there's monsoon every year. You have to have that contingency in plan. The flooding was way beyond that, but that's part of what you need to have as well. Michael? Yeah. So we have about 3 minutes left. So one other question?
Sure.
2 minutes left.
Sure. Just as far as the question that was posed here, just an example out there. I'm sure a lot of you heard about the bio-trial example about a month ago. Again, it's very pharmaceutical related, but I think it's being proactive, not just with a regulatory concern, but understanding what is your contingency plan. So for those of you not familiar, bio-trial is a CRO that was helping a European company on a Parkinson product. So obviously they had enough data to go, preclinical data to go into the clinic, went into phase 1, about 90 people received this medicine. Big event happened right away. 6 people in the hospital. There was at least 1 death. So I'm not saying I'm praising something like that at all, but there's obviously seeing things in current events and understanding, well, what would you do in that situation? How do you handle that type of failure?
Yeah, right. And that's why when we're looking at some of our service providers, we're really truly looking at their global capabilities, right? So, and again, it depends on your scale, right? How big the operation is that you're trying to outsource. But typically, we look for providers that can service us through various countries, right? And we ask them, okay, so if something happens, in India, what are you going to do? And so them say, we're going to go to the Philippines, or we'll do some out of Brazil, some out of Romania, but they have a plan at least, right? So I think also picking the right provider these days is a really, really.
In my 10 seconds, you have one question? Sorry.
I guess really I was speaking to your question to the audience, so to speak. I'm in financial services work with Equifax, and the CFPB has been auditing us straight for about 24 months. I know other bankers in the room can probably speak to the same experience, but They've been to our call centers. They've been to our data entry operations. They've been through all of our contracts. And really what it, luckily for us, we require all of our suppliers to be compliant with law, regardless of where, and compliant with the laws that apply to us. And our security requirements, we require all sites to be PCI certified. We have a huge security policy. Our security folks, before we do any outsourcing, have to go visit the site and physically test. And then, we as a sourcing group, we visit each site each year. So it is real, and it's getting more stringent, not less. So I fully agree with what you're saying, but that's been our experience. And to have the CFPB sitting down with a call center agent who's not getting paid a lot of money, or a data entry agent, it's a scary proposition for them as well as us. So,
yeah, I mean, what we've done with our external manufacturing, we actually integrated a lot of our quality teams with these folks. So it looks like one team. And now we have a consortium of about 40, and we actually give out rewards, right? And some of them, they had some gaps, right? And we help them out with their processes to make sure that things are safer, right? But at the end of the year, we have these awards, and so they're motivated. You got to get the right incentives in place to get them motivated. Although they're external, you need to make them feel like as if they're internal, right? That they're an extension of your team. And I think that's where the breakdown is. A lot of folks say, "Hey, let me just throw it over the fence and good luck," right? I think that's a terrible mistake. Yeah.
Well, thank you, everybody. I think we're between you and cocktails at the expo. So again, thank you so much. And if you can rate the presentation on the web, that'd be great.